This is an overview of Dialectical Behavior Therapy, or DBT. DBT was developed in the 1980s by Dr. Marsha Linehan to work with people who were chronically self-harming or suicidal and had frequent psychiatric hospitalizations. Over the years since then, there's been a lot of robust research that has demonstrated that DBT is really effective with a variety of types of emotionally sensitive people. The common factors are that they all tend to have chaotic interpersonal relationships. They tend to have trouble regulating their emotions or dialing down the volume on their emotions. And they have difficulty tolerating distress without hurting themselves, hurting someone else, or making the situation worse. What DBT does is teach these folks skills that they were never taught. DBT is different from other therapies in a few ways. One of its biggest contributions is that it recognizes that emotionally sensitive people are doing the best they can. Dr. Linehan's idea is that some folks are born more sensitive than others. That is, they tend to react very strongly to stimuli. They tend to go up like a bottle rocket. It takes them a long time to come back down. The most psychologically challenging of these people, those who have the diagnosis of borderline personality disorder, may also have been brought up in an emotionally invalidating environment. What does that mean? An invalidating environment is one in where the child is taught that her lived emotional experience isn't her lived emotional experience. For example, she says, "I'm hungry," and the adult says, "No, you're not, you just ate." Or, "Don't be sad, you have so much to be grateful for." Or, "Don't get angry, it only hurts you." These are all examples of invalidating statements. So you take someone who arrived on the planet more sensitive than many other people, and you place that person in an environment that tells him or her that he or she doesn't feel what she knows she does feel. Well, of course that person is going to have trouble tolerating emotions and being uncomfortable. No one ever showed her how to. And of course he isn't going to know how to regulate those emotions. He was only told that they didn't exist or that they shouldn't exist. DBT says to the patient then, you are truly doing the best you can. DBT also says you have to do better. So something else unique about DBT is that it builds on a base of cognitive behavioral therapy by adding a component of mindfulness. So in addition to teaching patients skills to survive crises without making things worse and to dial down the volume on their emotions and how to ask for what they want or say no and be taken seriously, DBT also teaches them to be mindful of their thoughts, feelings, and body sensations. So think about this. If you don't know how to survive feeling uncomfortable feelings, then wouldn't you want to avoid them? Well, of course you would. But there's a problem when we avoid. Our emotions tend to get bigger and bigger and bigger, and eventually they come in through the back door and they bite us in the butt. So what DBT teaches is mindfulness skills so that participants can learn to approach, not avoid, their thoughts, feelings, and body sensations without judgment. The final thing that sets DBT apart from other therapies is the protocol, which is in 4 parts. There is weekly individual therapy, which at the outset is very structured. There is also a weekly 2-hour skills class. It's not group therapy, it's a class in which participants learn new skills, are assigned homework, come in each week and report on their homework, and have an opportunity to practice these new skills. Between sessions, the 3rd part of the protocol is that patients are instructed to call their individual therapist whenever they have the urge to harm themselves, kill themselves, or practice one of their problem behaviors. Finally, the DBT therapist, him or herself, is required to be on a consultation team with other DBT therapists so that everyone's skills can be improved, so that they can consult on cases, and so they can get support for what is really very challenging work. It is challenging, it's also highly rewarding. I'm a DBT therapist because it works. It's not right for every patient who walks through my doors, but I find that many of the skills are applicable to almost anyone. I love seeing people's lives transformed by DBT, and I even find that I use a lot of the skills in my own life. And it seems to me that that's probably the highest praise that a therapist can give any therapeutic approach.